joined by Carys Moseley. Carys, I'm really excited to talk to you. You are, I believe, in Wales and have some really important insights about the recent ruling by the High Court in the UK.
Yeah, thank you. Yes, so I'm based in Wales in the UK, and I do a lot of writing and analysis on the policy across the UK for Christian Concern, which is based in London. And this High Court ruling this week on puberty blockers affected England and Wales. And so I don't know if this was covered in the USA. I think it's starting to be covered in other countries as well. It was a judicial review that was brought by a whistleblower, a lady called Susan Evans, who used to be a therapist at the Gender Clinic for Children and Young People in London, which serves England and Wales. And she grew alarmed at the fact that children were being prescribed puberty blocking drugs rather quickly when they came in with problems of gender confusion. And this was 15 years ago. She was there between 2004 and 2007. So it's a long time ago now. And she didn't feel her concerns were taken seriously. So she initiated judicial review and made an application last year, along with a mother whose name is not given in the press. This is the mother of a teenage girl on the autistic spectrum. And the mother was very concerned that she might be put on these puberty blocking drugs. And then they were joined by a third claimant, a young woman called Keira, who had been prescribed puberty blockers when she was 16 or over. And she's now 23. And she went on to live as a trans man for a few years. You may have seen photos in the press where she has a beard. She changed her name. And then she regretted what happened. She started to feel like she wasn't actually really a man. And was really upset and devastated by the effect that these drugs and also the cross-sex hormones and surgery she had were affecting her. And she decided to detransition. And so what happened gradually is that she became really the person in this case, brought by these three women. And a judicial review is what happens when an organisation thinks that, say, a public institution has not really followed the law properly as it should, and it asks judges in the High Court to look at whether they've really done that. And that's what happened. And what they were asking was, is it actually possible legally under the law in England and Wales for children under 16 to consent to puberty blockers? Because the question was, can they really understand the implications of this radical experimental treatment? And the court found, having listened to a lot of experts and read thousands of pages of evidence, found that they couldn't truly consent. So that was true for under 16s, but even for 16 and 17-year-olds, so those under 18, the court said really it welcomed the possibility of clinicians saying, well, we're going to have to go to court if this to see if this is suitable. So basically, the decision on puberty blockers has been you have to go to court now if you are a clinician who, or if you're a child who really says you want them, and to be able to prove that you can consent and understand all the implications.
And one of the things that I think was really significant from the ruling is that the High Court noted that these are experimental treatments.
Absolutely, and there's a long history of that. I think the other thing in relation to that, you've got to understand that the court took a very holistic view, which is good, and of course the opposition is really annoyed by this. They looked at the fact that a majority of the children who were given puberty blockers, not all the children who go and get referred to the clinic are given puberty blockers, okay, but of those who are, a majority then progress to being given opposite sex hormones, so artificial testosterone if they're girls, or artificial estrogen if they're boys, and then quite often, but not always, surgery, sex change or gender reassignment surgery, such as mastectomies for girls and removal or transformation of genitals and so on. And it's taxpayers who are paying for this, but also the judgment affects private clinics who may do more exotic treatments. So yes, it's the whole thing. I think when you're saying experimental, yes, puberty blockers are deemed experimental, but let's not lose sight of the fact that all of this is an experiment on the people undergoing it, I think.
And the other thing that the High Court mentioned is that, at least at Tavistock, the medicalization of these children seemed to be the only pathway. That the therapists were not offering any other treatment options, and so the only choice these kids had, if they wanted alleviation of these dysphoric feelings, was to go towards this medicalization.
I think that's true, and the key there is pathway. It wasn't explored in a very clear way, actually, because the court case was narrowly about the ability to consent. They did not necessarily explore in depth the alternative, which would be talking therapy, psychotherapy. And I'm very interested in that question. I've just written about it. An article has gone up today if you want to look at Christian Concern and read what's gone up. So Susan Evans blew the whistle 15 years ago. And we know far more recently, within the last 2 years, a lot more therapists, including her husband, who was also a nurse and had worked there, had resigned and spoke several times on condition of anonymity to the press about this. They were the ones who wanted to have talking therapy for these children, so, getting to know them as people and to look in depth at the origins and meaning of their problems, because they're not biologically based for the most part. I think so. There's obviously a long-term, I know from looking at some of their archive work, there's a long-term problem with different approaches among the different clinicians. Some favor talking and some favor puberty blockers. And they've probably never really been able to work together because these approaches fundamentally clash. But the second thing that's really important, that's not been said in the press, but that your audience needs to hear, is that the other reason there's a problem is that there is a professional ban on what's called conversion therapy for gender identity and same-sex attraction among mental health professionals in the UK. So you can't be a mental health professional in any registered or licensed with any of the mental health professional bodies in the UK and offer therapy to a client of any age, which assumes that one gender identity is preferable to another. That's the text of the policy, okay? But what that really means is quite obvious. You can't say, well, look, you're biologically female and you're born biologically female, and therefore it's actually better for you to live in your female gender identity and to continue along this path of this imagined male identity that you can, that's based on imagination, really. So that's the other problem that I want to see opened up.
And to me, that's just astonishing that basically they're suggesting that being transgender is equally healthy and a valid way of being as someone who isn't transgender, when in fact we know that the treatments given to these children and adults who identify as transgender are incredibly harmful. These people become medicalized for life. And it's oftentimes reinforcing self-hatred that these people have, and prohibiting therapy means that they're not able to identify the underlying causes of these dysphoric feelings. I just don't understand how that kind of a ban is justified.
Well, that's a good question. I think, again, when you look at the judgment, and it's well worth reading, it's written in plain language, the court expresses surprise at several junctures about the lack of data analysis. Now, that may sound cold and narrow compared to what you're talking about, but it is related. Basically, and they're not alone, and I've noticed it, a lot of people who've been observing and trying to get information from them have noticed this. They've not been recording properly or publishing proper data on the people who regret what happened to them, or the young people who desist, who don't go through with all the treatment. They start and then they stop. And it's obvious that they should be doing that. Of course, there's nothing in statute law in the UK that requires that. Maybe there needs to be. And if you don't have that data series of all the people who've been cohorts year by year, then you can't go further. But also think about how that data gets recorded. It's because you're interviewing people. You're talking with them. At some point, you're going to talk with the client and say, by the way, we do need to survey you. You'll be all anonymized. And there are certain points, we want you to answer. But they're not even doing that. So that goes with what some of the other critics of the clinic have been saying, which is there's a lack of curiosity within this institution.
So it wasn't that long ago that I saw some media about how some clinicians had come out expressing some serious concerns about how Tavistock was treating these patients, and then recently it seems like Tavistock came out with some new policy about using puberty blockers, and this was even prior to the ruling.
So it's really not so much the Tavistock as the NHS advice pages, and well, we don't know who exactly is responsible within the NHS. But it's interesting. My question: some people were praising these new advice pages on gender dysphoria, and because they were no longer claiming that puberty blockers are reversible, it contained more skeptical wording. But actually, when I started looking into this, I thought the NHS was sidestepping the issue and hiding. And I was wondering whether the activists were going underground in a way in anticipation of what would happen with this judicial review that hadn't actually yet happened. So, for example, the NHS page was saying this: it's also not known whether hormone blockers affect the development of the teenage brain or children's bones. Side effects may also include hot flushes, fatigue, and mood alterations. What they were not saying was that these things can be linked to early menopause. And that's not being said, although Keira Bell actually mentioned that to the press. And when you actually look online and try to look at scientific journals, there are instances of women being saying that they've gone through early menopause. And they might not be all the puberty blockers, but also with testosterone.
And for those who don't understand, this is a huge problem physiologically. That older women do go through menopause, but if you spend your entire life in a state of menopause, it's going to have huge repercussions physiologically.
I think it's pretty shocking, and I wish that journalists would be more inquisitive here. I think that we're only just starting to see doctors really, they need to look systematically into this. The problem is it's so hard for people to come forward and say they made a mistake. Obviously, I appreciate that. But, if my question is, early menopause is something that can happen to other conditions like anorexia. Is early menopause, is it actually shortening people's life expectancy? That's the question.
I would actually,
true.
Yeah.
Then what this treatment is doing is sending women to an early death. Right. Of course, I can't prove that. I'm speculating.
Right, but I would suspect that to be the case. So when I look at what's happening, it looks to me like we're sterilizing children and we're consigning them to medical interventions for their life and potentially shortening their lives. These are tremendous impacts on children, and I just can't imagine any other situation where people would sit back and feel okay about it, let alone advocate for it.
I mean, I think that's just with women. It's also some research on the men that's worth mentioning. Research was done on the NHS on male to female patients who had taken female hormones. And what happened with them, they had a 6-fold elevated risk of multiple sclerosis due to hormonal imbalances that were partly caused by taking estrogen. But there's nothing on the new NHS pages on that. It's absolutely scandalous. Do you realise what MS does to people? I mean, the irresponsibility is staggering. I don't even know where to,
Yeah, and that's where that research is so important to find out, what is happening to these children's bodies. And in the U.S., we recently had a ruling that, adult males who were taking testosterone to sort of, man them up or whatever, there was recently a ruling against the provider of the testosterone, and they found that it was harmful, that these men were having incredible harms as a result of taking this testosterone. And yet they're giving even higher doses to children and young women, which is, it's just hard to believe.
Yeah. Yeah, no. I think we're going to see a spate of these rulings. Actually, given what the case you mentioned, very different one in the US. I think that now the thing is that because there's no medical pathway in the UK or anywhere in the world for detransition and resistance. There's no systematic study being done of the problems, but I think that we will, over perhaps several years, see people come forward and say, "Well, I've got this and this and this, and I didn't know." Perhaps their GP will never have heard of that problem before, but the question will be, did the doctors linked to the gender clinic know about these problems and not talk?
And that's the issue is, did they know about them and not talk about them, or because they're experimental, did they not even know about them?
Yeah.
Either way, it's really scary to put children on medications when we really don't know their long-term impact. There have not been longitudinal studies to look at the impact of taking puberty blockers over a long term to block puberty, to block normal puberty, nor someone taking puberty blockers in conjunction with cross-sex hormones. Those are just that, it's a treatment protocol that's never been explored before. And I think one of the reasons that it's taken hold is because of the therapy bans that you mentioned,
Yeah.
that activists have come in and convinced people that these bans need to be enacted, and therefore there really aren't any other paths. And one of the things I was wondering if you could talk about is, I've heard that the UN is looking into the possibility of an international ban on therapy that would help people identify underlying causes for gender identity issues.
Yeah, I mean, the UN has an independent expert on sexual orientation and gender identity. So the second post holder is now in post, Victor Magical Bolos, and he's a lawyer from Costa Rica. And he really goes to town on hyperbole, shall we say, because he goes and calls what he calls conversion therapy torture. Well, you can't get much more dramatic than that. I mean, I went along with a bunch of people to this virtual meeting that he organized to launch his report on this subject over the summer. And yeah, it was interesting. I mean, to get a lot out of it, you had to have gone there. I mean, first of all, you've got to understand that the ban that he wants on gender identity therapy exists, as I've explained already, in the UK and probably other countries. What he would want is a criminal ban, a criminalization. So a step further. So if you were a therapist or counselor or a clergy member of any religion, you could be prosecuted for harmful speech, probably, or hate speech, or something like that. If you tell a person of either sex or any age, it's really better that you live in harmony with your sex. That is better than continuing on this imaginary path. So yes, that's a big deal, because he was offering help to the various countries in the world that were represented in this UN meeting. There was also a meeting with Harvard Law School, which is actually the one I went to. And, I know that our government, for example, in the UK, was asking for help because, whoever was instructing the diplomat who was there at the time thought that our ban wasn't strong enough. Well, it's already done a lot of damage over the last few years, as we can tell.
Well, that's shocking to me that they're feeling it's not strong enough. And one of the things, I tried to wade through the special report of the rapporteur at the UN regarding the conversion therapy ban. And one of the things that just terrified me is that it sounded like even parents could be prosecuted for conversion therapy if they did not affirm their child's chosen gender identity. And then
Yes.
teachers, and as you said, clergy. So basically, any adult who didn't 100% accept a child's declaration of identity could be prosecuted under this international ban. And yet here in England, we just have this ruling that the alternative, which is to medicalize these kids, which is where the UN is kind of pushing the acceptance of medicalization, actually are harmful and cause lifelong consequences.
Yes, I think this report by the UN expert needs to be revisited without delay, given this High Court ruling. Of course, the ruling is going to be, well, don't know if it's going to be appealed, but the Tavistock Clinic has is wanting to make an application for permission to appeal at the Courts of Appeal. So we don't know what's going to happen there. We need to watch out, and people internationally watching. But yes, in the UN report does specifically attack parental rights. Here's what it says. So if anybody's listening and interested, it's section 71 of the report. It actually characterizes parents who refer their own children for therapy for gender confusion or same-sex attraction as abusive. And it says, and I quote, parents are ill-informed about the nature of sexual and gender diversity, the invalidity and ineffectiveness of those practices, and the significant and possibly lifelong injury that they will cause their children. In light of these realities, subjecting children to practices of coach conversion therapy constitutes ill treatment and may constitute torture, as well as contravene domestic and international laws against child abuse and neglect. Well, you can't get more extreme than that. And you know, it's interlinked. They're attacked on children's dignity and on parental rights, and on clinicians as well, who know better than this propaganda.
Well, and there's just an absurdity in the report that compares, you know, gang rape to a child sitting with a therapist and trying to identify underlying causes of gender identity issues. And
yes, I mean, in the meetings, see what I did, we're in meetings on Zoom, but it was also, you had permission to ask questions live on Facebook, on his Facebook page, which was on public settings, so anybody in the world could see it. And I pushed back against that. I asked, you know, worded a question, you know, how can you please give examples. I think it was please give examples of actual therapists recommending what was called corrective rape or homophobic rape of a woman to supposedly turn her straight. Now, this is a real crime in some jurisdictions. It's obviously a hate crime.
well, and rape is a crime. I mean, I think
exactly.
Internationally recognized as a crime. And so it's not as though we're trying to criminalize rape, which is already criminalized.
Well, exactly. And then he actually did have to backtrack at that point. And I think it's because I'd asked my question also in the Facebook comment section, which was publicly visible, and couldn't backtrack. And the lesson I learned from that is we've got to show up when the other side libels innocent people like that as perpetrators. And we've got to show up and to say, where's the evidence? And that's the beauty of this court judgment. As I said, it was very strictly within the parameters of the law and consent. But in order to get there, the judges had to listen to all these experts and look at scientific evidence. So that is a route we must take.
Well, and that's where I think so much of this is being pushed by feelings and by those who want to be nice. And they are not understanding the implications of what's happening. They're not understanding how much damage these policies are having, that by banning therapy to help these children resolve these issues, they're putting them on this harmful path by suggesting that there's you know, that a trans identity is equivalent in health and happiness to someone living comfortably within themselves, that is consigning someone to higher rates of mental health problems, higher rates of suicide, and again side effects and complications from medical interventions.
Yeah, I mean, the question is, you put it as, you know, focusing on feelings. I mean, that's a very brief characterization of a massive, many-faceted problem, I think, because there are so many different people who've been put in this category of gender confusion, and you know, their feelings, their experiences, in a way we have to trust that they really have those experiences, but they have lots of sources. There's a difference between a child who's misunderstood family dynamics and feels less favored than a child of the other sex, than a child who's actually been sexually abused, was a runaway, than a teenager who's fallen into a fetish, and or somebody who's been raped and now doesn't want to be a member of their sex. So there's all these very different experiences, or the pornography addict, you know what I mean? They're all quite different. And it is interesting how gender identity politics has become pushed as an answer to all these problems, to which there are actually solutions historically in mental health care and in society. And the problem with these bans on therapy is that they shut down an existing living body of inquiry and knowledge, and they shut down relationships that make that possible between professionals and clients, and within families, and in society, with schools, with religious bodies. They shut down. People are too afraid to talk to each other for fear of being guilty of harmful speech.
Right. And that's one of the things that I see happening in the US a lot is that these therapy bans have been enacted, and a lot of therapists are unsure about the scope or definition. And so they don't want anything to do with it. They just are walking away. So this whole group of already vulnerable people are now no longer able to access the mental health services that they need, which I think is just tragic.
I've had, a counsellor recently. I was speaking at an event, and a counsellor came up to me, a former counsellor, and said that this had happened to these issues, and that just means there's a blank and a silence in the minds of the very people who want and need to be listened to deeply. I was a counselling client, and I know it's devastating if you are the recipient or would be recipient of pastoral care, and you find that nobody is capable of listening. But I just want to say one thing. Counsellors and therapists are not lawyers, and they're not used to poring over pages of judgments.
Right.
Their expertise is the one-to-one and small group relationships. And their expertise, their experience, what they've taken for granted for so long, is giving their clients the freedom to explore. And I think they've not stood up enough as a profession. I think they have just not understood enough as a profession that conversion therapy bans are not just about these issues. They function as a general attack on the integrity and credibility of their professions as independent of government. If you're not independent of government in private conversation, you're not free.
That's really true. And it's really undermining our confidence in both our mental health care providers as well as our medical health care providers, because now I know that there are certain issues that a mental health provider isn't able to address or may not be willing to address because of fear, and that doctors are embarking on these treatments for children that have no research to support their use. And it gets very scary when medical professionals are unable to do their job because of public policy pressure, and where individuals are unable to trust their healthcare providers because we don't know if the treatments we're getting are well informed and based on science, or if it's just because a lobby group happens to have exerted a lot of power over that treatment.
I think that's true. And it's very significant, by the way. I don't know if you realize this, but with this judicial review, two major transgender lobby groups in the UK, Mermaids and Stonewall, were denied permission to be third parties intervening in the case. The court said no.
Interesting. Can you explain for people who don't understand the role of the intervener? Can you explain the significance of that?
Well, they would just be giving, as they see it, expert opinion and evidence to the court on why they support one party more than another. And you're allowed to do that. And so let me find what I wrote about it. I'll tell you what it is. Why I looked at that. Yes, I've got it in front of me now. We don't know exactly why they were refused. I have seen it said. It was said on Transgender Trend, which is this blog and this organization that helped with the judicial review, supporting the claimants, that these organizations had submitted evidence to the court that was all based on things like anti-bullying and hate crime and so on. So kind of ideological and moral issues rather than the science and the issue of consenting to medical treatment. Now, I think there might be a backstory to this within the judiciary, but I can't absolutely prove my theory. And this is what I think, and I've written about it. The Stonewall was rebuked before by the former Lord Chief Justice in the UK. So the highest judge in the land at the time, he was called Lord Thomas. He's a Welsh judge. And he presided over another judicial review, which was brought by a transgender campaigner against an NHS trust. And this campaigner, this claimant, was actually a female-to-male person who was also an offender, a prisoner, and had been convicted of violent offences for several years. Quite an unruly, with a deeply scarred background, grown up and abused. You know, it's a very sad case, and was looked after by forensic psychiatrists, but you know, didn't want to accept the treatment. Now, of course, that's probably not new. You can, you know, but really, what they wanted was to go to the gender clinic for adults. I think it started off with these problems as a teenager. Now, Stonewall, and also the head of another group called Gyres, which is very close to mermaids and has worked with children, and also a very influential transgender rights lawyer called Stephen Little, who's a female to male person and was a professor of law. And also the head of Stonewall, then had made third-party interventions in this judicial review. And Lord Thomas heard that in 2017. And he dismissed the interventions they made as unhelpful because they were not based on psychiatric expertise. So I'm going to read you the little paragraph what he says, because it's important, because and the reason I want to mention this is that the press hardly picked up on this judgment. It was something like 20 pages. It was quite complex. And he says, there was also a statement by Professor Whittle, Professor of Equalities Law at Manchester Metropolitan University. Although helpful in providing background on transgender issues, it was of no relevance at all to the issues before the judge, as he had no medical qualifications. The same observations must be made in respect to the statements of Ruth Hunt and Terry Reid. So it's a polite statement.
Right.
It's not dismissively written, obviously, as a judge, but it's this exact same dichotomy that we see in this judicial review. And then what the Lord Chief Justice went on to do, he was very critical of the gender clinicians at Charing Cross Gender Identity Clinic in London, which is Britain's oldest gender identity clinic, and because the patient stroke offender had gone to this clinic. So he criticised them. They were supporting, those who were supporting this offender's referral to the gender clinic, who had ignored the expert advice of the forensic psychiatrists, okay, who are experts on dealing with offenders and also victims of crime. And the supporters had made the argument that the real problem was gender dysphoria. So everything was down to gender issues. And this brings another complication. If you have therapy ban, you can't really easily, as a clinician, have freedom to have free and frank discussions to distinguish those differences. You know, it's just not a healthy work environment. So there's a paragraph where he talks about that. It's quite long. I won't read
Well, it also means that the client or the parent of the client get to dictate the diagnosis of the, which is problematic. You know, having children come in and say, I am transgender, and the therapist has no way to explore that at all, and they just have to accept the self-diagnosis of the child.
That's true, but it's also true with adults. It's very interesting, actually, when we're looking at this judgment and reading it, and the implications that fall out, is how similar some of the issues are to adult treatment. The puberty blockers are unique to under 18s,
Yeah.
okay, really, but everything else, you know, the cross-sex hormones and so on, and the effects of that, dealing with adults, and the self-diagnosis as well. Because what happens is that you can go to your general practitioner, your local family doctor, and you say, I think I have gender dysphoria, and they talk to you. And the treatment protocols across most of the UK now is that they can send you straight to a gender clinic.
Right.
Now, I live in Wales, and the treatment protocols remained more restrictive for far longer. So here, until I think last year, if you went to your GP and said this, they had to send you to a psychiatrist on the National Health Service, and so a local one. So you had to have diagnostic tests, and they'd be able to find out, hopefully, where the other underlying issues. And it's a gatekeeper system, and that's how it should be. And of course, the activists don't like that. But that explains why, with adults and I think also children, why I've calculated our rate of referral here is much lower than in England and Scotland. So I'm hoping one of the things that will happen with this fallout to the puberty blockers is that they'll have to revisit the treatment protocol.
Yeah, and that's so important, because as with any mental health issue, someone suffering from it does not generally have lots of good insights when they're first sort of grappling with it.
Well, this goes back to the point about relationships, and we need to build them and not intimidate people into silence.
So I'm hopeful that this ruling will at least start to open up the conversation about these therapy bans and allow people to talk about them. One of the things that's happened to me when I've spoken against the therapy bans is that I've been labeled a hater, a homophobe, a transphobe, a bigot, a Nazi. And it's because people don't really understand the impact of these bans. And it's interesting to me that often they're being pushed by people who at the same time would say that, the privacy of doctor-patient relationship is sacrosanct in other situations. But in this situation, they're willing to impose their own ideology on it. So where do you see things going from here as we start to wrap up? Is there anything else that you wanted to cover that we didn't get a chance to?
Well, I mean, we focused rightly on the High Court judgment, which was this week. I think it has been a good few months and good year here in the UK, because there's been really in-depth pushback in the policy area on these gender issues. We've had the Scottish government at the beginning of the coronavirus pandemic in March shelving its plans to make it easier for people to change gender in Scotland. They didn't shelve them completely. They said until after the Scottish elections. But I think we don't know whether that's a soft way of saying we're giving up.
It's interesting too, because I interviewed.
Then in England and Wales.
Yeah, I interviewed a young woman from Scotland who went to the gender clinic thinking
Right.
she was absolutely sure that she wanted to transition to start testosterone. She went in there and they did a good diagnosis and identified that she was autistic. And that happened in Scotland. And she just said, what her situation was what should be happening in other places around the world.
Well, yes, I mean, she may have stumbled on the good clinician, that's the problem, but I think so. In England and Wales, they've followed now. The central UK government has said it will not make changing gender easier. It's lowered the cost, which is not great, but it's basically said no. It's listened to public's concern, doctors' concerns. People have been going in and out of the Prime Minister's office, basically, as we're being told. And there's going to be a review of the services, an independent review of the services for children and adolescents. And that was promised before the judicial review. And it'll be headed by a paediatrician. So it will be important for the professionals to feed into that. And I would say for those who've had experiences of treatment to write in, because their voices are important. So it's been good. And also the other thing that's happened is that in England, schools are no longer allowed by the Department of Education to tell children that if they're gender non-conforming, that they might be born in the wrong body. And they're also no longer allowed to work.
Yeah, which is just, it's shocking to me that schools would ever have said that in the first place. But thank goodness that they're backtracking on that and saying, no, you can't mislead children like this.
Well, but it's not just that. It's not just telling the teachers and the staff that, which is one thing. Because obviously you might have an in-school counsellor or a special educational needs officer as well. They need to be told that. But also schools are no longer allowed to work with outside groups that come in and say these sorts of things.
Right.
Well, it is groups like the ones we've been talking about that would be more likely to do this. And so we've been seeing them backtrack on their rhetoric. Oh, we never really meant literally born in the wrong body. Oh, yes, you did, actually. We're following you.
Yes.
People have been losing their jobs for opposing this in the UK.
Right. Yeah.
What we have in the UK, which you're going to, if you get Joe Biden as a president, you will have a push for the Equality Act USA. And that will be more radical than the Equality Act that we've had for 10 years, because it will include a criminal ban on conversion therapy.
And I don't think people have any idea of the implications of these kinds of legislation. Again, it's that kind-hearted people who just want to be tolerant, and they don't understand the ramifications of these policies and how incredibly damaging they are.
I mean, the press in America, they've barely mentioned this. They've been very generic, I find, about the Equality Act. But really, if you want to know what that type of Equality Act could do, you should look at the UK. It's very interesting to me, because normally you would think of the US as the place we look to, where there's a proper, traditional reality-based response to all the crazier aspects of progressivism. But actually, the development has come in the UK, and not through politicians, but through going to court.
And I think that's probably what's going to have to happen in the U.S. is that, as girls are losing out on their opportunities to have female sports, as women are no
Yeah.
longer safe in spaces where they're vulnerable, as our children are being medicalized. All these things, at some point there's going to be legislative action, and I think that might be, as in the UK, the way that what turns the tide. Unfortunately, in the meantime, a lot of people are being harmed.
Yes, absolutely. And I think we've had one person, this week standing up and saying that, but we know that there are quite a few more people. I mean, I speak to people who've been through the transition, and they're vulnerable, especially with lockdowns as well.
Mhm.
So you've got to watch out for that as well. The path we're taking in the Western world over socialization and healthcare.
Yeah. Well, thank you so much for sharing your expertise, and especially for that. I really found your analysis of the judicial review really helpful.
Thank you.
Being from America, I don't know if we have that process or not, but it definitely is a little bit different, and it helps me to understand the impact. And I'm also really excited to hear that they are going to do a review of the practices of
Yeah.
what's been happening at Tavistock, because I think that might just blow the whole thing out of the water. I really
Right.
believe once people understand the long-term consequences of what's happening, we are going to look back and just be sickened by what we were allowing to happen.
Yeah. 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 It's got to come into the light, definitely. And
Yeah.
this is, I am hoping that this is a part of that.
Yeah. Well, thank you for your efforts. I know it's not easy.